shall we? Alright, I'm gonna lift this pen and you're gonna follow it with your eyes, okay? Left, left, right, right, up, up, down, down. Once more. Left, right, up, down, down, up, left, right. Okay, well, your eyes seem to be in working order. That's good. No problems with vision, correct? Perfect. Alright, let's take a look at your ears. Yeah, I'm just gonna take a quick look inside of them. Each one, yeah. I'm sure they're clean, don't worry. Let's see. Okay, next ear. Okay. And you're hearing just fine, yes? Perfect, okay. Now, let's see. I'm gonna check your heartbeat and your lungs really quick. So, first, let me listen to your heartbeat. Okay. Now, I'm gonna need you to take a deep breath for me and then release it, okay? So, one huge breath and then one release. Ready? Go. Okay, and do it again. Okay, and one more time. Perfect. Sounds like your lungs are in working order and your heart seems to be beating just fine. I'm gonna take this little instrument here and just lightly whack you on the knee right here. I'm just testing your reflexes. Okay. Okay, they seem to be in working order. And while you're here, do you want your height and weight measured? It's not mandatory, it's optional. But if you would like to know your exact height, I can tell you, and your exact weight, of course, but I know some people opt down on the ladder. Alright, well, you're just here for a checkup, but tell me, how are you overall feeling physically? Have you felt a little sick at all? Is there anything you want to tell me? Any kind of concerns that you have? Okay, you just want to get checked up to make sure you're okay. Can you do me a favor and stick out your tongue? Yeah, just stick out your tongue like you're sticking your tongue out at me. Okay. I'm gonna put this tiny little instrument in your mouth and I'm just gonna test your temperature, okay? Maybe I should test mine with all these little hiccups in my words. Yeah, it's been a long night, you know? I've been on call all night. Okay, so, no fever, you seem to be okay. You look like you're in perfectly healthy order to me, and I've seen a lot of patients, so I call them like I see them, and I know right away typically nothing is hurting you, right? Nothing externally or internally. Okay, just like I thought. That's good. Now that's good. Well, you are fine, and you should be fine. But we could take a little moment here to give you a little learning lesson on health if you'd like. Just to keep everything in proper working order. Let me check your bones one more time, okay? Your reflexes and stuff. I just want to make sure that your bones are nice and strong. Yeah. Question actually for you. Have you ever heard that song from childhood about which bones are connected to which? Do you remember it? Really? Well, it goes something like this. The foot bone connects to the leg bone. The leg bone connects sternum, which may alternatively be included as the manubrium body of sternum in the exopoid process. It is composed of 270 bones at the time of birth, but later decreases to 206, 80 bones in the axial skeleton and 126 bones in the appendicular skeleton. 172 of 206 bones are part of a pair, and the remaining 34 are unpaired. Many small accessory bones, such as sesamoid bones, are not included in this. The precise count of bones can vary among individuals because of natural anatomical variations, but the human skeleton of an adult usually consists of around 206 bones. So if somebody ever asks you how many bones are in the human skeleton, you always want to say around 206. And if you have a bonus brain to remember, you can remember that there's actually 270 at birth, but it decreases to 206. That might be something worth remembering. And if you're wondering why, I can tell you. You see, as a person ages, some bones fuse, a process which typically lasts until sometime within the third decade of life. Therefore, the number of bones in an individual may be evaluated differently throughout a lifetime. In addition, the bones of the skull and face are counted as separate bones, despite being fused naturally. Some reliable sesamoid bones, are counted, while others, such as the hallux sesamoids, are not. Individuals may have more or fewer bones. Bones, which are located along the sutural lines on the back of the skull, and sesamoid bones, which develop within some tendons, mainly in the hands and feet. Some individuals may also have additional, i.e., supernumerary cervical ribs or lumbar vertebrae, amputations, or other injuries may result in the loss of bones. Complete bone fractures may split one bone into multiple pieces. Other genetic conditions may result in abnormally higher, e.g., polydactyl or conjoined twins, or lower, e.g., oligodactyl counts of bones. The axial skeleton, comprising the spine, chest, and head, contains 80 bones. The appendicular skeleton, comprising the arms and legs, including the shoulder and pelvic girdles, contains 126 bones, bringing the total for the entire skeleton to 206 bones. Infants are born with about 270 bones, with most of it being cartilage, but will later fuse together and decrease over time to 206 bones. temporal column. A fully grown adult features 26 bones in the spine, whereas a child can have 33. Because remember, bones decrease over time, which means children will typically have more bones than adults. The cervical vertebrae is 7 bones. The thoracic vertebrae is 12 bones. The lumbar vertebrae is 5 bones. The sacrum is 5 bones at birth, after adolescence, and the coccyx is a set of 4 bones at birth. Now, what about the pelvis? The pelvis consists of 2 parts, anterior and posterior. Note that the posterior bones comprise the lower parts of the spine, where they are primarily connected. Anterior bone, the hip bone or pelvic girdle, is 1 bone. Liam, ischium, pubis. The posterior bones, which is the pelvic spine, are the sacrum and coccyx. The upper limb, arm and forearm, and hand. There are a total of 64 bones in the arms, 32 in each arm. Upper arm bones, there are 6 bones in total, 3 on each side. There's 2 humerus, 1 shoulder, which is the pectoral girdle, 2 scapula, and 2 clavicle. The lower arm bones is 4 bones in total, 2 on each side. Left bone, the ulna is 2 lined up with the pinky, and the radius is 2 lined up with thumb. The hand is 54 bones in total, 27 in each hand. The carpals, so it's 2 scapuloid bone, 2 lunate bone, 2 trochlear bone, 2 pisiform bone, 2 trapezium, 2 trapezoid bone, 2 capitate bone, and 2 hamate bone. The metacarpals are 10 bones in total, with 5 on each side. The fillings of the hand have 28 bones in total, 14 on each hand. The proximal fillings has 10 bones in total, on each side. The intermediate fillings have 8 bones in total, 4 on each side, and the distal fillings have 10 bones in total, 5 on each side. Now we're getting to the lower limb, thigh and leg and foot. There are a total of 8 bones in the legs and 52 in the feet. So the femur is 2. There's 2 patella or kneecaps. There's 2 tibia, 2 fibula, and 52 bones in total in the feet, 26 per foot. So, dorsus, there's 2 calcaneus or heel bones. There's 2 talus. There's 2 navicular bone. There's 2 medial cuneiform bone. There's 2 intermediate cuneiform bone. There's 2 lateral cuneiform bone. There's 2 cuboid bone. There's 10 metatarsals. There's fillings of the foot, which are 28 bones, and 14 per foot. There's 10 proximal fillings, there's 8 intermediate fillings, and there's 10 distal fillings. So, let's do a little pop quiz here. Yes, 29. Do you remember how many are in the chest? Yes, there's 25 in the chest. Do you remember how many are in the spine? Yep, 26. You have a very, very good memory. Clearly, your memory is good, which means this checkup is just going absolutely swell. A good thing about checkups is testing your brain sometimes. That's really what I was trying to do here, was test your memory to make sure that it's in working order. I like to make sure that I thoroughly check my patients, so not just exterior, but interior as well. Let's do another little quiz, okay? Let's do the quiz of what was connected to what. So the foot bone was connected to what bone? Yes, the leg bone. And what was the leg bone connected to? Don't skip it. Yep, the knee bone. And what was the knee bone connected to? Yes, the thigh bone. And what was the thigh bone connected to? Yep, the backbone. And what was the backbone connected to? Yes, the neck bone. And what was the neck bone connected to? Yes, the head bone. You're correct. And again, how many bones are in the adult human skeleton? Yes, 206. And how many are you born with? Yes, 270. And how many bones are in the human skull? Yes, 23. And how many are in the human head? Yep, 29. And how many bones are in the chest? Yes, 25. And how many are in the spine? Yep, 26. I'm genuinely impressed. You have a very, very good memory. So now that I've tested your brain, I feel much more confident about letting you leave the office. But before I do, let's do a further little checkup here just to make sure everything's completely fine. Would you say that any part of your body feels a little achy or off or weaker than the rest? Okay. When is the last time that you were sick? Okay, and how long did it take for you to recover? Okay, and do you eat and drink when you're sick, or do you just stay in bed and eat as little and drink as little as possible? Okay, and what were you last sick with? Okay, okay, and when is the last time you came to the doctor? Okay, so do you not typically go for many checkups? You should definitely get that going. It should be a routine for you. When was your last shot? Have you had the flu shot yet? Because we can provide it today if needed. I know many people don't like to get their shots done, but it's for safety measures. Well, don't worry, it's not mandatory, it's only optional, just like checking your weight. Okay, no problem, no problem. No, that's completely fine. Are you typically scared or nervous to go to the doctors? Yes, a lot of people are. I can see why they would be, but I guess not every doctor sings the bone song to you, huh? Do you remember the tune? what does your diet consist of? Don't worry, this is not a weight issue. I'm just curious about what you're putting into your mouth. Okay, well, make sure to incorporate a lot of greens, okay? You want to eat vegetables in your diet just for maximum health. And let me ask you something. Do you smoke? Okay, well, no judgment. Just asking, do you drink? Okay, yeah, you want to do those as, you want to do those as little as possible. You don't want to do them too often because they could affect your health greatly. Yeah, of course, I would advise against doing both, but that's just advice. I can't make you do anything you don't want to do or force you not to do something that you want to do. I'm just your doctor looking out for your best interests to keep you healthy. Is there anything you'd like to tell me about how you've been feeling? If it's mental, you can also tell me that because we could get you help for mental. I could just direct you to someone who can help you more. See, I'm more of the physical type. I can help you with physical ailments, and if you do have memory loss of any kind, or your brain seems to be not in working order, I can direct you in the correct path. Well, I know sometimes people have emotional issues that could be mental, and there's no problem with that. It's not actually a problem, it's just I can give you resources to ease those issues. Yeah, because we don't just want your body healthy, we want your brain healthy too, right? Yeah, we want to keep all of you healthy. Every inch of you, every bone. All 206 of your bones. All 23 in the skull. All 29 in the head. All 25 in the chest. And all 26 in the spine. Well, I'm just giving you a little bit to remember. They say if you repeat things in 3, then it sticks to memory. I guess we'll test that little theory out, won't we? Well, you look great to me. You seem to be completely coherent and completely alert. But I can keep you here for a moment longer just to ensure that you really are of good full health before I check you out. Well, I have to check you out to check you out. Get it? Just a little doctor humor. I know. Who do I think I am, Patch Adams? Yeah, I know. There's probably some misconception about hospitals. You probably think that they're all like ER or Grey's Anatomy or any of those, drama series shows. I once had someone tell me that they overheard their nurses gossiping and they felt like they were in Grey's Anatomy. Isn't that funny? I don't think they were gossiping about anything patient related. I think they were just gossiping about their own lives. Yeah, we don't make judgment on patients ever. You're completely safe. You're in a judgment-free zone. We're only here to help. I've never actually even seen Grey's Anatomy or any of those doctoral type of shows. They're just not my thing, I guess. Have you watched them? You know what? I have seen something though that I must admit. I did watch House. Yes, I did watch House. And it's a very good show if you ever want to watch a medical procedural. Yeah, now my brain is working in funky order. Yeah, I have had a long shift, but don't worry, I'm completely capable of checking you out. Well, do you have any body, any scratches, bruising, ailments of any type that you forgot, but maybe you can remember now because I can check them out for you. Yes, I'll even check out little scratches, I don't mind. Just to make sure they're healing properly. I know another issue that some people have with doctors is that they'll come in and they'll show them something and the doctor will either dismiss it or say that it's something that it's not, but I would never do that to you, don't worry. If you come to me with a concern, I'm going to take it seriously and I'm going to pursue every avenue possible to ensure that we know what it is. I won't just tell you that I know what it is. Like, I once heard of someone who came in with a allergic reaction on their mouth, and the doctor on call, not here of course, this is just a random story, but a doctor apparently took one look at their mouth and told them that it was not an allergic reaction and that it was actually an ST, you know. Yeah, which was very uncalled for, and we don't typically do that, and anyone who does doesn't seem to be trained properly. Well, it appears that the patient tried to tell them repeatedly that it was not what they said it was, but they insisted because doctor knows best. But, you know, we have to work together to find out what your ailments are. I can't just take one look at you and know because you know your body better than I do. You know the history of your body. You know what's normal and what's not normal. So I rely on your knowledge to help me figure it out so we can figure it out together. It's kind of like House, where House sees a patient and then he has to decipher what the issue is because sometimes it's what it doesn't look like. Yeah, I guess that's just me wishing I was in House, huh? Well, I would love to meet him, but he does not exist. Maybe one day I can be House. So tell me, are you interested in the medical field? Because nursing is a great career path. But I'm not here to recruit you, I'm just here to help you recover and to check you out, and honestly, you seem very good to me. Of course, I could have you do a few jumping jacks and push-ups just to make sure. I'm kidding, I wouldn't do that to you. We don't need any kind of physical strain right now, we're just in here for a checkup. Everything is a-okay. You have a good bill of health with me. Do you have a regular doctor? Well, you should see them more often. Trust me, doctors are not as scary as they seem. I mean, I didn't scare you, did I? I've been relatively calm, haven't I? I just hope I haven't made you feel like you're in an episode of Grey's Anatomy. If anything, I kind of hope I made you feel like you're in an episode of House. Well, do you feel better about coming here today? Do you feel better about being seen? Like I said, if you would like me to take a longer look at something, I'm more than happy to do so. There's no rush to get out of here. I do have other patients, but each one is very important, and I will take all the time in the world that I need to with you if you need my assistance. I pride myself on being a very, very thorough doctor. So if there's anything else that you need, you just need to let me know. you born with any birth defects? It's just a routine question, don't worry. Okay, and do you have any pre-existing condition that I need to know about? Like anything, you can tell me anything. Okay, do you have asthma or diabetes or anything of the sort? Any known allergies? Let me know if you're allergic to anything. Okay, yeah, I just need all this information. I'm actually going to um, write this down in a chart so that I have a chart history of you. Yes, in case you come back here and need more help, then we'll have all the knowledge that we need. Is that okay with you? Don't worry, I will not write anything bad in your charts. I know that's another sitcom moment. I don't know if you've ever seen Seinfeld, but there's an episode of Seinfeld where the character Elaine goes to the doctor and she discovers that the doctors have been writing notes in their charts about her. Bad notes that make them not want to work with her. It's pretty comical, but it's not true. I will show you the notes after I write them so that you can see there's no personal opinions or commentary on our patients like that. I do believe that vets actually do that though. Not just about their animal patients, but about their human clients. I have been told that's a thing, so I guess if you're curious, the next time you go to your vet, ask to see your chart. You'll be surprised about what's in there. Only, of course, if you've ever been a little bit difficult, I suppose. Us doctors don't care about people being difficult because we work with all kinds of people, and sometimes people are difficult because they're sick and their ailments make them difficult, and it's not really them, it's what's wrong with them. They're just frustrated and in pain, so it makes sense why not everyone is the most nicest or polite, and that's why we don't write charts on them like that. Of course, if a patient is aggressive, we will write, um, you know, tendency to be a little aggressive so that the next doctor or nurse knows, just to give them a heads up, but we never say anything like, you know, they're this or that, or any personal type of thing about them being a bad person. We don't do that. Yeah, you're well protected here. Well, if you want to make me your normal routine doctor, we can actually go ahead and try to work on that. But if you'd rather stay with your own doctor, that's completely fine too. I support any and all doctors. Except, of course, the ones who are telling people that things are wrong with them that are not. Well, I'm glad that you felt good today in our checkup and that you checked out great because I feel much more confident about letting you walk out of this office now. Before you go, let's do a quick check. How many bones are in the human adult skeleton? Yep, 206. How many are you born with? Yep, 270. How many bones are in the skull? Yep, 23. How many are in the head? That's correct. 29. How many are in the chest? Yep, 25. And last but not least, how many are in the spine? Yes, 26. You aced it. Body checks out and memory checks out. And now you can check out.